Hey guys, this is Z. How are you? And this is me again on Z Nutrition. Someone asked me to talk about preeclampsia. What is preeclampsia? Preeclampsia is hypertension during pregnancy, and this usually begins at 20 weeks during pregnancy, especially with those with normal pregnancy. Complications that happen during when you have preeclampsia: first, preterm birth, fetal growth restriction, placenta abruption, organ damage, cardiovascular disease. Those are the common ones. Those are the few ones that I'm going to mention here. Symptoms when you have preeclampsia: protein in urine, you have nausea and vomiting, you have severe headache, you have decreased urine output, you have blurry visions. Causes of preeclampsia: we're talking gestational hypertension, which means you have hypertension during pregnancy; chronic hypertension before pregnancy, if you have that. And what are the risk factors? What are the risk factors that can make you get this kind of condition? We're talking age, we're talking obesity, we're talking first pregnancy, we're talking multiple pregnancy, we're talking people with history of preeclampsia. If you've had it before, yes. Chronic hypertension, race. When you're a black person, it's very common in black people than the white people. Now, please bear in mind, this is not a medical diagnosis. I'm not doing a medical diagnosis for you. I only have to speak about this because I'm going to talk about the nutrition part in a minute. So please don't use this as a medical diagnosis, and do not self-diagnose yourself. If you have some of the symptoms that I just mentioned, you might really want to go to the doctor. Don't say, my friend had this, my brother had this, my sister had this. Sorry that I mentioned brother, but my sister had this, and all of those things. Be very, very careful. This, again, I cannot begin to overemphasize the need for us to know in Nigeria that everything is not spiritual attack. Not everybody wants to get your pregnancy under attack. You need to be very careful. When you see some of the other symptoms, you need to get to the doctor as soon as possible just to get things checked. So let's go to the nutrition part of it. Basically, when you're pregnant, it's just very important to know that you eat a balanced meal. We're talking carbohydrates, protein, fat, vegetables, and fruit. That's what will make your meal very balanced. Now, when you're pregnant, generally, your calorie intake is based off of your pre-pregnancy weight. Your protein intake is also calculated. So it's very different for everyone. Few point, you have to increase your protein. If you have preeclampsia, you have to increase your protein because you're passing out protein in your urine, which means you need to put more to it. Eat 6 meals a day, which means very small meals, like every 3 hours. Add protein to your meals. We're talking beans, we're talking fish, we're talking eggs. You need to add those to your meal most often. Low-fat diet. Be careful. Don't be eating too much high-fatty food. Reduce your caffeine intake. If you're drinking alcohol during pregnancy or smoking, you need to stop it. I think we all know that those are those two things. It's something that you do not want to do. Avoid raw foods. It's very, very important that you don't eat raw foods during pregnancy because of food safety reasons. Fluoridanono. If you drink fluoridanono during pregnancy, I know that we do that, but modern days, you really need to be very careful because you don't know what is in it. So those are the few points. Remember that I said pregnancy calories, what you're going to eat is calculated based off of your pre-pregnancy weight. So it's very different for everyone. It's different for you when you're having twins. It's different when you're having just a baby or triplets. It's very, very different. So for everyone, it's not one size fits all. Thank you so much. If you need more information, like I always say, please come inbox. I will be so glad to do it, but just know that that's a private consultation, and that would incur a cost, a little bit of cost. I can negotiate. I don't mind negotiating with you guys, but I'm willing to be there to give you that services. Thank you so much. I love you guys, and I appreciate you guys that share my video. I appreciate those of you that are commenting on my page. Thank you very much. Bye.